this is the layers, the dermis, the subcutaneous area, this one, and this is the connective tissue. It's at the left, and after we have here the fascia, and this is the muscles at the end. This is the layer. If you take any cut in the skin, all right. So if you are going to do a suture, the most important in this area, if you have a wound, this area should be, the dermis should be closed nicely, then you close the upper skin. If this one is closed nicely with resorbable suture, then the skin, no problem, non-resorbable. The most important in deep wound, this should be sutured. But if the wound is superficial, only the upper skin is enough. Okay? Closing the fascia, which is covering the muscle, also it is not much important, but if you do it, it's better. So facial closure is usually, but not always required. Approximation of subcutaneous, this is subcutaneous, aid in healing by closing dead spaces. If you keep it open here and you suture only up, the healing will be not nice, it will go down the wound. But if you suture from down up, the closure will become aesthetically and nice looking. If you don't suture here, the blood collection, the dirtiness and things like that will accommodate here and infection will happen, okay? So approximation of dermis achieve good surface alignment and relieve tension so the epidermis can be closed with a good cosmetic results. The best cosmetic result occur if the epidermis is perfectly aligned and tension free. Don't, if you do suturing, don't too much tear. If you do that one, what will happen? The blood supply will be less in healing, will reduce, and necrotize will happen. If there is no blood supply for the area you are suturing, the healing will be not nice. It will die. حتموت.
But doctor, how you will check that?
From the color.
Wound? No, from the color.
From the color, when you are suturing, if you too much, look, my finger, if I do too much light, it will be white color. No need, just keep the rose color, just bring it nicely. Just when it is approximated, finish. Don't do too much. If you do too much, see how much it will become white color.
No, how you will check that? It is the epidermis, dermis, or subcutaneous wound.
If you are doing here, this is the epidermis, the derm you are suturing. Below is the epidermis. So once you are closed, and this one, the upper is coming, so you have a nice place. Suture material, look, the material which is available in the market, you have this kind, three kind. Absorbable, vice, no absorbable. If the patient is moving and going to travel and he will not come back, suture with absorbable. If he is coming back, non-absorbable, in oral cavity between 7 to 2 weeks you have time to take it out. Okay? Absorbable usually take between 15 to 20 days to be absorbed. Only the catgut, it take about 10 days, the chromic one. The plain, it take about 5 days. Natural vice synthetic. We have natural like the silk and the cotton and things like that. Vice synthetic is the one fabricated in the companies. You have monofilament vice braided يعني خشن ملفوف. monofilament بتكون one piece. أيوة. This one. You have the absorbable, the name is the cut, it's taken من لحم البقر or sheep submucosa, okay, natural. Synthetic, it's called Vicryl or Monacryl PDS. Non-absorbable هو الحرير, natural مثل السلك أو السلك الأسلاك أو الكوتون. Synthetic you have the nylon مثل تبع السمك اللي يصيدوا سمك, Prolene, Etiobond, Dacron. This is the names of synthetic which it is fabricated. This one is the braided, and this is chromic catgut. This is the plain, all right. This is braided silk. This is polyester, is giving you the shape. This is the stainless steel معدني بتكون. Okay. Polypropylene هذا nylon. It's this.
Nylon.
This one we use it to suture the skin because it not give you scar.
Yes.
Okay, the nylon we use it 4050 for the skin. Okay, nylon monofilament, one piece it is. You see, like this one. Suture materials uncoated, plain suture. If absorbable, breaks down faster. You remember, uncoated, yani it is resorbed faster. If it is coated, like a chromic, there is antibiotics. If absorbable delays, break down. This is the suture's diameter. You remember, you have from 0.2 to 5. We use usually 0.3, 0.4, 0.5. Most we use in dentistry in oral cavity 0.3 or 0.4. Okay? This is the length. How many diameter is it?
How the suturing makes scars?
Do scars because if you don't close the wound nicely and you don't approach it nicely and you do it by tension, some wounds, if you don't approach it nice and by tension and use force to approximate, this wound will not heal nicely because by force you reduce the blood circulation. So healing will be not nice. You try always in this kind of wound, we go in the dermis and dislocate, نفتح بنحاول نفتح بنخفف التنشن مشان نقرب الجرح to approximate the wound. Okay, we reduce the tension from both sides to approximate. Okay, this is the way of
Doctor,
surgical.
0.2 is the bigger than
Yes.
0. Point.
Yes,
Here it means that
This
0.1 means 1.
this one is very thin.
No, here it is from 0 to 5, not 0.5.
It's no, it is 50. They write like this or they write like this.
They are writing like this.
Okay, no problem. But 50 it is. It's mean 50.
Yeah, 5
But
0.
here also.
No, there is no
like
5. There is no 5.
4.5.
As the
Yes,
other.
Ahmad, you can read like this. That's all.
Okay,
No, no.
okay, 50. It is no. You read metric size. Non synthetic absorbable surgery.
Like
Up
this.
size.
Like this, doctor.
No. This is up USP size. Something we usually
needle.
metric size. We use this one. Okay. This look. He's telling you this is. You follow this one, please. Okay. This, if you go from 1 to here, is the large one. Okay, this you remember. If you go from 0 to down, it is smaller. The suture properties, the absorption, the capillary absorption, the fluid absorption, it should accept these materials. Tensile strength, قوة الشد should be normal. Breaking strength, sometimes if too much force we use, it تنقطع. We don't want that one. Elasticity, when you suture with tension, should have relax the wound. Okay, this is all the properties the suture have. Plasticity, the memory should have that keep the wound together. Payability, easy to manipulation, you use it nicely. يعني ما تسبب لك مشاكل أثناء الخياطة. You study all this, you read about it. The properties, strength, pull, tension, strength, knot strength. When you suture first, second, it's go nicely. ما تفك بعد ما يعني don't open the wound. If you suture, not finish. It will stay in place at least 15-20 days. Okay, this is called the knot pull tensile strength. Suture properties, suture pull out value, the amount of force on a suture required to cause tissue failure. Measurement, okay, look, I have a patient outside. We'll do now clinical extraction for him. You will see how we